Thank you for having me here today. My name is Phetsamone Phoummavong, and I'll be presenting on a thesis project entitled Mental Health and Well-Being of Southeast Asian American LGBTQIA+ Adults. According to the CDC's latest Census Bureau data, suicide is the second leading cause of death for AANHPI between the ages of 15 and 34. Now, national studies conducted by the CDC as well as the Trevor Project have found that Asian Americans with intersectional identities of sexual and gender minorities are at 3 times greater risk for suicide attempt. When we look at disaggregated data, we can see that there are differences between ethnicity in terms of level of severity for risk of suicidality and suicide attempt. Now, this data is alarming given that Asian Americans are the least likely demographic to seek mental health care counseling. In order to learn more about this population, we decided to conduct a scoping review on Asian American LGBTQIA+ mental health, looking specifically at mental health outcomes of depression and anxiety. Now, out of 924 articles, only 18 met inclusion criteria. Of those, 6 were Asian American focused, and of those 6, only 4 disaggregated by Asian American ethnicity. However, the main ethnicities represented were Chinese, Korean, Filipino, Japanese, and Indian, and only one study included Southeast Asian groups. Now, our scoping review reveals that Asian American LGBTQIA+ are often underrepresented in this kind of research, and furthermore, Asian American ethnic minority groups are even less seen. In collaboration with Mekong NYC, a Southeast Asian nonprofit based in the Bronx, New York, we developed a survey for Southeast Asian LGBTQIA+ on mental health. Now, the survey started distribution back in March 18, 2024, and is ongoing. We've worked with Southeast Asian and/or LGBTQIA+ organizations locally and nationally to help get this survey out. Now, our survey includes questions on adverse childhood experiences, depression and anxiety, and also level of outness. Our study currently has 44 participants, 30 of whom are Vietnamese with a mean age of 27. Now, for sex assigned at birth, majority are female at 68%, but interestingly for gender identity, only 36% identify as female. For level of outness by life domain, we've got most individuals out to the world generally and the least out to religion. When we look at subgroups, individuals are most out to siblings, new straight friends, and old heterosexual friends. For mental health outcomes, we've got 9.5% of our sample indicating moderately severe depression, 23.8% moderate anxiety with adverse childhood experiences, 43.9% with 3 or more adverse childhood experiences. Now, half of our sample report household mental illness, and 36.6% report both physical and psychological abuse. Now, our survey is still ongoing, so if you or your colleagues are interested in taking our survey, please scan that QR code in the corner. Thank you.